Right, a blessed morning to all of our viewers that is on Facebook and that's of course on YouTube as well. Now, this particular video, this topic is going to be on stroke and its effect, its causes, and how what we're going to basically deal with how we're going to overcome this problem. And the main thing, of course, is to prevent the issue in the first place. Right, so stroke of course, happens when there's like a blockage to the brain or through the blood vessels to the brain, a blockage in the blood vessels to the brain, or lack of blood flow to the brain itself. Now, to help a person get over this issue, it will take time, it takes effort, you really have to put in a lot of work into it. Another thing, of course, with a stroke is that you have two different types of stroke. So as you watch with me here and we look at this particular image, you will see what you call ischemic stroke or hemorrhagic stroke. Now, most persons tend to develop both of them. Hemorrhagic stroke is where you get like bleeding, okay, and ischemic stroke, if there's like a little blockage that will take place, either a thrombus, which is like a blood clot, that tend to form and cause, or if there's narrowing of the blood vessels to the brain, a lack of blood flow can actually bring about a stroke. Now, there are many symptoms and signs that person may have to actually look at carefully, and we're going to be labeling some of them, and then I'll give you some of the causes into a stroke. Now, the symptoms will be simple. It's sometimes difficult to actually alleviate the symptoms or basically look at them carefully. You really have to be watching at a person who is experiencing that stroke. So, for example, trouble speaking and understanding what others are saying. So this is for someone to look at you carefully. You may notice for yourself if you're leading on to a stroke. So number one sign is trouble speaking and understanding what others are saying. You may experience confusion, a slur of words, or have difficulty understanding speech. The other symptom would be like paralysis or numbness on the face itself, or in the arm, or sometimes even in the leg. You may develop a sudden numbness or weakness or paralysis in the face or the arm or leg. So as you look at these symptoms carefully, it's always good to have someone around, but usually when persons are not around, this is where the difficulty of a stroke comes in. All right, so this often affects just one side of the body. All right, to raise both of your arms over your head at the same time, if you tend to actually feel that, then it could be that a person may be heading on to a little stroke. If one arm begins to fall like that, like it just hangs out, that could also be an indication of a stroke as well. You may be having a stroke if these symptoms come. Now, of course, there are many other symptoms as well as we go further into this particular program. So one side of the mouth may actually droop like this a bit. All right, so I'm trying to just mimic that for you so you'll be able to get to see it. So it comes like that. And if you find a person looks like that, where one side of the mouth is kind of hanging down a bit, that's an indication that that person may be heading into developing a stroke. Now, problems seeing in one eye or in both eyes, all right, you may suddenly have a blurred or blackened vision in one or both eyes, or you may see double. Now, this is for a person who may be experiencing a stroke. So, of course, at Eden Heights Clinic, we tend to take care of stroke patients. Now, it's what I love for persons to do is to really prevent the issue. So that's what we focus mainly on, and preventing strokes. So I advise person to come in to sit with us, talk with either Dr. Navarro, myself. There's also Mr. Diaz, who works with us as well, who will be able to sit with you and give you so much information that you'll be able to prevent a stroke in the first place. Now, there are some persons who may not get bleeding, who may not may not see any signs of it, but then you're a person that is really stressed out, that is really frustrated, that you've been dealing with anxiety and things like depression. Automatically those type of persons could lead on into a stroke as well. If your blood pressure levels are really high, that's a risk factor. If you're a person that smokes, that's a risk factor as well. If you're not exercising, if you are type 1 diabetic or type 2 diabetic patient, you could also lead on into a developing stroke. If you have clogged arteries, from the time you have clogged arteries, then there's the artery that goes to the brain, the carotid artery. Once that is blocked, automatically those persons can lead on into a stroke. Some persons may have like a brain tumor that can actually affect the blood vessels, affect the nerves, and they could also lead on to a stroke as well. So you have our numbers, you also have our location, and today we're talking about stroke and its causes and how to deal with it overall. So continuing with our symptoms, you may get a sudden severe headache. Now, this one has to be severe because there are persons who generally get headache from time to time, and most headaches come where a person is not drinking enough water, and that comes from dehydration. So if you're that particular person, you may be experiencing headaches from dehydration, or if it is that you have high blood pressure, you may be experiencing that as well. So a sudden severe headache, which may come on all of a sudden, which may become accompanied by things like vomiting or dizziness or loss of consciousness. That may indicate that a person is actually leading on to a stroke. Trouble when walking, you may stumble or lose your balance. That can also indicate if a person will lead on to a stroke naturally. So these are some other these are basically just an idea of what you can look for if you know that you're a person that want to prevent a stroke in the first place. These are the symptoms that you're going to look out for. Now, the fix for this, if you already have a stroke, you'll need to do physiotherapy. You will need to change how you eat in general. You'd have to be careful of anything with heavy amount of dietary cholesterol that may affect the brain function. You may also have to be careful of anything with too much of calcium that may actually affect the arteries as well and cause hardening. Salt, too much table salt can also affect a person that may cause stiffening of the arteries. Of course, if you observe any of these symptoms, you may definitely need to call your emergency number. Now, that number, I'm not going to put the number directly what we would use, but of course, person will use their number within their country that they will respectively. Now, the best diet that I've seen to prevent a stroke or to basically let you're not going to get major events of stroke is what you call a plant-based diet. If you notice here, lots of nice fruits and vegetables, tomatoes, potatoes, you're looking at blueberries, you're also looking at lemons, limes, and so much more to prevent the event of a stroke in the first place. Right, so lovely vegetables, flaxseed, which has a lot of omega-3s in them, which can reduce inflammation. You have avocado, which has a lot of vitamin E that can also help. Your green cruciferous vegetables, they work excellent to keep the blood flowing freely, and that is how you're gonna prevent the development of a stroke as much as you can. As I said before, there are risk factors into it: obesity, high blood pressure or extremely high blood pressure, diabetes that is not controlled, or sugar levels that is not controlled properly. They are signs and symptoms. If a person develops a tumor, that could also bring about a sign and a symptom as well. So I thank you this morning, this afternoon. this particular video is very short, and I hope that persons will pay very close attention to the information of how to protect from stroke and the risk factors of developing a stroke. All right, we're going to go into some more information within the coming weeks of how to really prevent strokes and heart attack, and dealing with things like the disease of things like cancer, diabetes, prostate problems, and so much more. So give us a call. Our numbers are here. All right, you can share this particular video with your friends and families so that they will be able to prevent development of stroke. Right. So I hope by God's grace you have a good afternoon, and take care.